that whenever your instructor approaches you and asks you about your patient, you never say fine. You never say the patient is okay, because the follow-up question could be, if your patient is fine, then why are they in the hospital? Why are they in the hospital? In this video today, I want to speak specifically to nursing students that are currently in their clinical rotation, where they're actually at the clinical site and taking care of an assigned patient, maybe even 2 assigned patients. So let's go. When I was a nursing student and on my clinical site, whenever the instructor would approach me and say, tell me about your patient, or she or he would ask, how is your patient doing? I would say the patient is fine. Wrong answer. And I am here to tell you exactly how you should respond to your clinical instructor when they approach you and they ask you, how is your patient doing? Or they say, tell me about your patient. Say though, it is perfectly okay for you as a nursing student to clarify any question that your clinical instructor asks you. For example, if they say to you, tell me about your patient. Now that's a vague, very general question, right? You can ask your instructor, exactly what information would you like for me to tell you? Or do you want for me to give you my head-to-toe assessment? Would you like for me to discuss history of admission? Would you like for me to tell you about the patient's current status? It's okay to ask a question and clarify, so that way you know exactly what information they are seeking. One thing you're not going to get me to do is to sit here and pretend like I don't know how some clinical instructors are. They'll come and they'll ask you a very vague question, and when you start answering, they catch an attitude and they'll say things like, well, that is not what I asked you, or that is not what I was looking for. Especially those that do not provide any information or provide a guideline to their expectations. They will be quick to say, that's not what I asked you. So let's get into it. First things first, we are going to assume that the instructor wants a complete history of admission, some assessment data, and current status. The first thing you want to talk about when she asks you about your patient, you want to present your patient demographics. Let's just say you were assigned Mr. John. Mr. John is a 53-year-old full code male. He is not on any contact isolation. He was admitted with a diagnosis of pneumonia. That right there gives a straight shot as to the patient that you're taking care of, their diagnoses, code status. Of course, you want to go into a little bit of the history of admission. We said that his medical diagnosis was pneumonia, but how do we know, how did we come about this? What exactly led up to Mr. Jones being diagnosed with pneumonia? So I always tell nursing students, give a brief history of admission. So a brief history of admission would be something like, Mr. Jones lives at home with his wife. He woke up on Sunday morning and he was not feeling well. He felt achy, he had a cough, he felt short of breath. His wife checked his oral temperature. Oral temperature was 38.4. He got out of the bed to go use the bathroom and ended up falling. His wife tried to get him up. She could not get him up. They called 911. The ambulance came to the home. When they arrived to the home, his blood pressure was 88/60. He had a heart rate in the 120s. He was somewhat confused. They brought him into the emergency room. Of course, you want to tell a little bit of what happened in the emergency room. Upon arrival to the emergency room, Mr. Jones was given 2 liters of normal saline. His blood pressure improved. In the ER, his blood pressure improved to 120/64. His heart rate also came down to the high 90s. He was still febrile. They gave him Tylenol. They did a chest x-ray and then a chest CT scan. And that is how the diagnosis of pneumonia came about. There you go. Let me tell y'all something. That information that I just gave you, once you're assigned a patient and your instructor asks you about that patient and you present your patient in the manner in which I just suggested, your instructor is going to be like, okay. And if they're not impressed, they're a hater. That's just it. Some clinical instructors are just going to be haters, and that's just that. That's the reality of the situation. I wish we could fix it, but I'm here to tell you that's what it is sometimes. Also, you're going to have some clinical instructor. Based on the information that you just gave them, they're going to want to quiz you. So I advise you to go back and watch my video. I'll link it right up here, and it's where I give you all tips and kind of advice on how to comb through the patient's chart. So that way you can pull a lot of the information and have it written down if in fact your instructor asks you anything about the patient. So another thing is that everything about your patient does not have to be memorized. It is okay to have it written down and you can refer back to it. So go ahead and watch that video. That way you know how to go through the chart and get a lot of the information. So when they ask you that question, when they try to get nitpicky and ask you specific questions, you can say, hold on, let me go through my notes because I did see it in the chart when I combed through the chart and it's right here. Once you've given her that information, you can go ahead and ask her. Take control of your situation. Ask her, would you like for me to run through the assessment data that I've collected thus far? Some instructors might say no, wait until post-conference. Some instructors might say yes, go ahead. And that is when you will run through your assessment. Now, I will do a whole separate video on assessment because that is a lot to cover. I usually reflect back on my nursing school experience, and I remember not knowing exactly what to do when I got to clinical. All I was told is that show up, make sure your uniform is clean, make sure that hair is pinned up, small earrings, no excessive jewelry, cover up any tattoos. I don't have any tattoos, so that was never a problem for me. Bring your lunch, even though you may not get a lunch. These are the things that I was told to show up to clinical. So when I got to clinical and they would be like, oh, go assess your patient. I'm like, what, go assess the patient? Like, what does that mean? Or I walk into the room and the patient room is dark and they're sleeping. I walk back out like, I don't want to wake them up. Like, no one explained to me. So that is the reason why I'm using this platform to kind of explain and to give guidance to nursing students in the clinical setting. Basically, there you have it. You just gave your instructor some information that she asked for. Very easily, very simply, you went through it. She said, tell me about your patient. You gave her the patient demographics. You gave her the diagnoses. You gave her the history of admission, how the patient was at home. He had a fall. They called the ambulance. The patient was brought to the emergency room. It is very important to let your instructor know that you understand the process of how the patient ended up on this med-surg unit. It is very important to give the interventions that were taken in the emergency room, because by doing so, this also gets you ready to give shift report when you finally graduate and you pass your NCLEX and you're now practicing as a nurse. You will be responsible for giving shift report, shift handoff, whatever you want to call it. And that is the order in which you will end up giving shift report. So I hope you found this video useful. Leave me some comments, ask me questions. Nursing students specifically, let me know any kind of information you would like for me to do a video on. I am willing to, take any kind of tips, any kind of suggestions. So let me know, and I will see you all in the next video. Bye.